Hi, I'm Joshua Elston, and today we're talking about lower facial slimming through neck liposuction and buccal fat pad reduction. So the buccal fat pads are little discrete pockets of fat that are in your cheeks, and it can contribute to lower facial fullness or swelling and the appearance of not being as thin as you are. So in buccal fat removal, what we're doing is targeting those specific fat pads. So often when someone comes in and they're seeking either buccal fat removal or neck liposuction, it makes sense to talk about both of them. Both procedures slim the lower face, and that's ultimately what the patients are looking for. They feel like their face is square or it's boxy, and they want to have the appearance of a tapered look or more of a heart-shaped face. So oftentimes we'll combine both because they have really powerful effects together, but they can be performed in isolation by themselves. Benefits of neck liposuction include a more crisp jawline and decreased fullness in the submental or the chin area. People say double chin liposuction or chin liposuction and neck liposuction. They're all kind of interchangeable because you're decreasing the appearance of fullness. So that's most notable in profile view when someone's looking at you from the side, but you can also see benefits in a quarter angle view as well as straight on as well. I think the biggest benefit of doing both of these procedures together is that by themselves, each one is good, but it's not great. Whereas if you're doing two different procedures and trying to achieve the same goal with them, you can do things much more subtly, but the overall result is much more powerful. Is the buccal fat removal permanent, or is it going to come back over time? And actually it changes over time as we age. We lose fat. So part of the success of the surgery is demonstrating some restraint and judgment and not removing all of the fat. Take all of the fat pad out when someone's young or in their 20s or 30s, they'll end up looking very gaunt over time because they'll lose that fat naturally. So is it permanent? Yes. Will it change some over time? Also yes. I think the biggest safety concern for me is what we just discussed, that you don't want to take too much fat. You don't want to look good now at the expense of your future self, having a problem down the road. So the biggest thing I think is that patients will sometimes feel a little bit underwhelmed if they have the procedure in isolation, because while I'm trying to preserve their appearance down the road, in the short term, what that translates to is that you don't have as much of a powerful result. That's why I like to recommend the different procedures together, because then I don't have to be as aggressive with one procedure and I can use two different procedures to achieve the same result. Other risks that we talk about with buccal fat removal are the risk of damage to the nerves or having some weakness of muscles. That's usually temporary if it does happen and resolves after about 3 to 6 weeks. One of the concerns, obviously, with any type of plastic surgery is the costs, and we always put our prices on the website so that whatever they are at the time of you're watching this, they'll be current. But usually when we combine procedures, there is some type of discount or bundling that comes along with it, so you're not just stacking up the prices. In terms of whether or not this procedure is affordable, I think neck liposuction and buccal fat removal are some of the more affordable facial rejuvenation procedures. We'll have more young patients seeking out these procedures. So, it's the people that want something subtle. They're not looking for a facelift, which is a much more expensive procedure. It's people that want something that's effective, that does have some change, but they're not necessarily looking to spend tens of thousands of dollars on this procedure. Ultimately, patients want to know, is buccal fat removal worth it? One person may be seeking one thing while another patient may be seeking something else. And part of the consultation process is figuring out if the procedure is actually going to meet their goals. Really, it's not about the specific procedures. It's really more talking about how do we achieve lower facial slimming. And aside from the surgeries, there's a couple other things that we can do as well. One of them would be neurotoxin to the master muscles, which help to contribute to the fullness of the lower jaw. And really what we're trying to do is just target anything that could be masculinizing or more of like a square set boxy jaw, and trying to take that into more of a tapered look. So the buccal fat removal can help to taper in the mid cheeks and the fullness there. The neck liposuction can help to crispen up the jawline and give a nicer profile appearance. And then as I talked about, the neurotoxin to the master muscles can also help to taper in and just to overall create a more of a heart-shaped face rather than that square boxy look. For all of these procedures that we've been talking about, they can all be performed comfortably in the office with minimal sedation, so you don't have to have a breathing tube or an IV, you don't have to go to sleep. This is similar to having dental work done. For the buccal fat removal, we're doing tiny incisions inside the mouth so there's no scars externally. And for the neck liposuction, it's usually just one small incision under the chin. So everything hides very well. I mean, obviously the effects of the surgery can be very powerful and very good for someone's appearance, but it's not that you have to have all these scars and incisions. If you've watched this far in the video, you're at least pretty interested in buccal fat removal or neck liposuction. The next best step is just to set up a virtual consultation. We do them for free, and it's a good way to figure out if you and I fit together. It's about 15 minutes, it's a Zoom call, and it's really a good opportunity to just do like an advanced Google search with me. So if questions have come up and you want to get those answered, it's a really good way to do it, and it's really at no obligation other than your time.